Amber, this is Deb Hinson joining for the first time. Do you prefer us to have our video on or off?
Either way is fine, whatever you're most comfortable with. I know that some people work in offices where there are a lot of things going on, so whatever works for you.
Very good, thank you.
All right, guys, as I'm letting new folks in, we'll give them about till 1:35. If you guys want to drop any wins that you guys have had out in the community in the chat, just as a look back on 2021, feel free to do so. All right, thank you guys so much for coming today. It's now 1:35, so we'll go ahead and get started. Thank you to you guys who shared your wins from last year in the chat. It's always really nice to look back at the previous year and see what we've accomplished. And I think we're all doing a lot out in the community. So today we'll start off with a Hawk update from Taylor Brandenberger, and we'll also hear from Allison at Phoenix Mobility and Yvonne at the Housing Bureau for Seniors. I'll be giving a program update on Barrier Busters and where we're at with our flexible funding. And then we'll adjourn. I expect we'll be done a little bit early today. But that's not a bad thing. You guys can enjoy your afternoon. Taylor, if you want to kick it off, feel free whenever you're ready.
Absolutely. Thank you for having me. As she said, my name is Taylor. I mostly go by TJ as we have multiple Taylors over at Hawk, but either's fine. I'm not particular about it or won't be offended if you use, either or. Either is fine. But I am actually, I'm the one who has been overseeing the Sarah program within Hawk. And then recently at the end of December, when Shayna left, I filled her position then as the new Hawk program coordinator, and very excited to be here. For this meeting, I'm here to kind of provide the Hawk the Hawk Sarah update that Kara normally provides. My apologies if it's not the way that it had been done in the past, but if you guys have any questions at all, I'm more than happy to answer those. And trying to make sure I didn't forget anything, but yeah, I'm just gonna hop into it pretty quick. We actually did receive a fairly large update to the Sarah guidance with the new Sarah ERA2 funding source. There's some new requirements of the tenants that's gonna make it harder for tenants to qualify, unfortunately. MISTA changed the ID requirement first and foremost to requiring specifically a Michigan State ID, which is, not good and going to be a very large barrier. We do have minimal workarounds for undocumented folks that would be, entirely impossible for them to go about getting that. We do have some workarounds in place for that. So if you have a client in a situation like that, just try and reach out to someone at Hawk and try and, communicate that, and we should be able to still work with them. Anyone though that, is a documented citizen that, is capable of getting a new ID, but just has, for instance, an out-of-state ID. They recently moved from, an adjacent state, Indiana, Ohio, etc., and haven't updated their license. That would apply to those people. They would have to go to the office of the Secretary of State and request a new ID. As soon as they have that temporary paper ID, however, they'd be able to upload that, and that would suffice. They don't have to wait until they get the actual physical ID. Another document requirement that was updated. Previously, they had loosened the proof of income requirements. They tightened that back up again. Before, anyone that didn't have documentation to support their reported income could simply self-attest and sign their name to say, what they were making. They are going back to requiring at least 2 weeks of documentation for income. So if it's someone that gets paid bi-weekly, it's just the one pay stub. So they did lessen the total required documentation, but they are requiring documentation again. The only people able to self-attest their income moving forward will be individuals that are earning zero income and reporting, they're self-attesting of the fact that they aren't earning any income, or people that are 100% self-employed and are basically, you know, earning income out of their own owned LLC, etc. Those are the main, or those are the two big changes to the documentation requirements. And then the other big change, which is the one that is going to be the biggest wrench thrown into the system, is MISHDA's requiring individuals to have had and still have, excuse me, arrears from some point between March 13th, 2020 and December 20th of this past year, 2021. Meaning anyone that is just now falling behind on rent for the first time wouldn't qualify for SARA. They would have to call our intake and inquire about our normal everyday eviction prevention funds, such as ESG, barrier busters, different, you know, resources like this, and, you know, other avenues of trying to prevent the eviction. But unfortunately, it seems as though MISHDA is really trying to phase out and wind down the SARA program. Not necessarily a decision we are all happy about, to say the least, in terms of care for the community, because at least in our opinion, you know, the need is definitely still there. And it's, you know, we're likely going to see a lot of individuals in the coming months that are going to fall into that situation I just described, where they're just now falling behind for the first time, or fell behind, caught up, and are now falling behind again. That being said, anyone that has previously had an initial application approved can still recertify regardless of when they fall behind again. The recertification applications basically don't consider the arrearages, theoretically. It's just, you know, a lump sum of 3 months of whatever your rent cost is. It doesn't take into account, you know, when they fell behind. Only that initial assistance application, so first time applicants, that would apply to. The other requirements, like the documentation, that, however, would still be required of recertifications. That applies across the board to everyone. And the last thing then is also, we can no longer do utility only. They have to have had that rental arrear for SARA. If it's a utility only case, we are required to deny and refer to SER at the DHHS. And then once they've gone through that resource, they could reach out to, you know, other utility assistance resources, but pretty much all will require to go through DHHS and the SER first. So that's where we are directing people. Anyone that's denied for not having eligible arrears either, for instance, people that just recently fell behind, we are directing to alternative resources as well. I didn't have the time, unfortunately, to pull like statistical number updates for the program, but if that's something everyone would be interested in seeing, I can definitely pull that and share those with people that are interested. But I now kind of wanted to just open it up to questions. I also see I got a question about putting those dates in the chat. So yes, I will do that as well for anyone that missed that. But if anyone has any questions about these new requirements, I know it's a lot and kind of really changes the system in a very big way. So if anyone has any questions on exactly logistically, you know, how this is all going to play out now moving forward, by all means, I'm happy to answer.
I had a brief question, TJ. We're still only allowing folks to recertify once, yes?
No, they can recertify up to their monthly allotment cap. And thank you for bringing it up, because that actually is one smaller update that I forgot to include there. They did bump the total monthly caps up. So before it was 13 and 15. 15 months for anyone 30% AMI or below, or sorry, 50% AMI or below, and then anyone between 51% and 80% would then just get the 13 months. They increased both of those thresholds by 3. So instead of 13 and 15, it is now 16 and 18. So anyone, as long as they are 50% AMI or below, should get a total of 18 months, and they can recertify as many times as they want in 3-month batches until they entirely max out those 18 months, or 16 if they're in that higher AMI category.
Thank you. That was helpful. I see Yvette's got her hand up.
Yes.
Hi, how are you today? Welcome.
Thank you. Happy to be here.
I wanted to ask you, I've got a lot of clients that have filled out for the SARA. And I know they've filled out for the SARA. And then when I go to look for their status, it says that nothing was sent in. So I'm kind of like, what do we do about that when they didn't owe rent? But they did have the DTE, and I have their SARA information that, you know, the 2 numbers, and it never went through, I'm guessing, question mark?
Okay, yeah. So for the cases to come through, as long as the tenant fully submits their side of the application, it should show up for us. That being said, the status lookup on the customer end, I know was not working for a very long time, and we were actually getting pretty much inundated with a lot of calls from clients being like, what's the status of my case? What's the status of my case? Because same thing, they would go to look and the portal would basically tell them it doesn't exist, which wasn't true. And so, excuse me, as far as I'm aware, they have fixed that. So you should be able to at least see the status if the case was indeed fully submitted. Unfortunately, as far as it goes for cases that were already previously submitted as utility only, we have been instructed that those don't get grandfathered in any way, unfortunately. If they weren't processed by the turn of the year, unfortunately, we have to direct them elsewhere, which I personally don't agree with, but is what, you know, we have been instructed to follow.
I'm gonna follow up with that.
Yeah.
So I've had people that I have personally, I do all the SARAs for my clients. So I know that they've been inputted, and I still can't find that information. But what also I'm finding distressing is that a lot of the applications haven't been processed since September or October. And then now what I'm hearing, I'm kind of like really worried about this, is, well, they're not going to be grandfathered in now. So what do we do then?
So, excuse me, yes, ones that won't be grandfathered in for whatever reason, we're obviously going to direct to different resources. I know on our side, we've been doing our best to get cases worked out as quickly as possible. You know, it's kind of really difficult to give a time frame just because a lot of it's outside of our control as far as how long it takes a landlord to get back to us with the ledger, how long it takes the lawyer to get the COD back to us, sorry, condition of dismissal for people that don't know the court lingo, how long it takes for them to get that back to us after we, you know, calculate how much they're supposed to get and send those worksheets. And then by the time we even get the COD back, it's basically out of date, needs to be redone again. So that makes it really hard. And that's why some of the cases have been sitting there for a very long time. Excuse me, we've also been, just due to the volume, been forced to prioritize cases that are in court and have a judgment or a writ already, and trying to focus on those before the clock runs out, before they're put out, which is made it so that individuals that, you know, their landlords are being nice and necessarily haven't taken them to court, it puts them in a tough position because, you know, they're not necessarily at immediate risk, but that's only because their landlord's deciding to be nice and comply, which in that situation, if landlords express that they have become very impatient and uneasy, we've been, trying to get those assigned out as well to ease those burdens, like people that have been waiting a while. But yes, there are unfortunately going to be a lot of individuals that this negatively impacts. And we had a very long talk with the courts when these came out as far as how this was going to look in the eviction court system and how that is going to be addressed. And we are implementing a new kind of two-tiered review system to try and mitigate this as much as possible. Essentially, we're going to start having a team of people combing through each application that's been submitted thus far, checking to see if they have everything that's needed, whether or not anything shows that they would immediately be ineligible and need to look elsewhere, things like that, and then assigning out to reviewers and processors once it has been determined that the case is fully eligible. Because there, as the system has been set up and as it's been running, the caseworker basically goes, from front end to back end, collecting all the documents, communicating with the client, doing the assistance calculations, hunting down the COD, and all that. We're breaking it up to where once a case is assigned out officially to a caseworker, you should know they're eligible and they're in good standing. And then the point of the screening early is then to also find individuals that that might be in that situation where they aren't going to qualify for SARA, and we need to start looking elsewhere and trying to get on that as quickly as possible so that there aren't cases like it has been that have been, sitting around for a very long time before they actually end up on someone's desk in front of someone, and then it being, way down the line when they find out that information. Our goal is to hopefully make initial contact with everyone that's submitted a case so far in the coming weeks. And so that way, we can mitigate that as much as possible, but it looks like it is going to be something that unless the state steps in and changes their decisions, that it's going to be hard to avoid it entirely and that'd be an understatement. But yeah. Sorry, that was really long-winded and I don't know if it directly answered your question. So if not, feel free to follow up. But
I mean, it did, but I guess my biggest concern is all these have been sitting out there, since last year and they haven't been looked on because of prioritization, which is fine. But now the people that were qualified are now unqualified. And then you mentioned to direct other people to other resources. Is that to the resource that they were initially getting the SARA help from? Such as, their caseworker and their caseworker has to figure out how to navigate it, or is Hawk gonna actually and whoever else gonna be able to provide resources? I just need to know where to go.
Yes. So as far as other housing resources, we would still be the ones directing them. So our full-time HRS staff, the housing resource specialists that aren't currently working with the SARA program, that are working with the other programs, they would then be directed by the SARA program reviewers to those individuals to help them figure out their situation and figure out what resource is best for them. So the person of contact that will be helping them will, yes, still be through Hawk. The funding and the resources, might be partnered through another agency depending on the person's situation. But yes, we would still be the ones helping them at least navigate to those other resources. So you can still have direct them towards us. That being said, with all the SARA stuff, our calls are very high and it's kind of hard to connect to intake. So if you have clients that are calling specifically just for a status update or things like that they could look up through the portal, we please ask that you encourage clients to not do that, because it's going to take away then from the ability for people that can't get SARE assistance to get through to those HRS folk. People that currently have a SARE application obviously will just basically be immediately directed over to those individuals, won't have to, go through the whole, I can't think of the right word, but the whole jump through the rings of going through intake and all that. They would basically have intake reach out to them to schedule them an appointment to meet with an HRS staff.
TJ, we have a question from Hugh Goodman in the chat asking about turnaround times for SARA applications put in now.
So again, that it's kind of hard to give an overarching estimate with this old system we've been running. Ideally, with this new system we're putting in place, everyone that's submitted so far, ideally, if we don't run into any roadblocks or anything, should at least have an initial contact from someone telling them whether or not they should be eligible or what documents they need to provide for that to be determined within at least 3 weeks. Each agency, SOS and Hawk, has about 600 cases currently in their submitted queue. And over at Hawk, I plan to have a team of at least 8 people on that initial review, and feasibly they should be able to get through at least 10 apiece a day. So, really lowballing, it should, hopefully be no more than 3 weeks. I would hope even sooner that they'd at least get that initial contact. As far as how long it takes beyond that, it'll depend how quickly they get back to us. But then the goal with this new system is once they have submitted everything, theoretically, the turnaround time should be very quick because everything will be there that the reviewer needs to calculate the assistance. It'll just be them inputting the numbers. If it's a court case, they'll just have to wait for the COD. That'd be the only thing externally that they need to wait on. And that would be it. So the goal with this new program is to be able to give a more accurate, well, one of the goals is to give a more accurate turnaround time as opposed to it being all over the place as it has been. So ideally, moving forward, they could expect to get at least an initial contact very early on here in the coming weeks. As far as how quickly it'll be turned around then is still up in the air, if that makes sense.
Just to follow up on that, TJ, a question I've seen from residents and community members asking about renewal times, just because they're concerned about clients having gaps. How is that going for you guys?
So we're doing our best to stay on top of that. MISTA actually stepped in to quote unquote help us and take a batch of our research applications to process in-house at MISTA. From what we've heard from those cases, there's been very little to no communication, and it's basically they're not helping, they're making it more difficult. So we're trying to get those cases returned back to us to just deal with them in-house. That's been our biggest slowdown recently, is just complications out of our control and decisions that we didn't make that then didn't go as we were instructed they were going to. So we're trying to rectify that and get the research. There's about 50 research cases that were with Washtenaw County that MISTA is now processing. We're trying to get those back because as it's going, it has caused a slowdown. So we're overcoming that. Once we get past that and hopefully get this system running, the research should be fairly straightforward and quick, as there's not a lot of new things required. That being said, with the new document required, or the income documentation requirement coming back, if the client's unable to get that income document in or just drags their feet, takes a long time, that could slow it down as well. But if everything goes ideally and everything that's needed is there, it can be a very quick turnaround if needed.
Thank you. That was very helpful.
Thank you. No problem. Anybody else have any questions? I know this is a lot, and hopefully I'm not the Debbie Downer of your Wednesday, because none of this is, really good news to be hearing. So I apologize. Anybody else? Let me see if there's any in the chat.
Yeah, I don't see any more questions, TJ. Thank you so much. That was so helpful. I really appreciate all the transparency and what's going on.
I'm always on the side of, things are going to work the best and the smoothest if, everyone just knows what's actually going on. So always big on, yes, being transparent with the situation. So that being said, I see Cherish did share my email in the chat. Thank you, Cherish. Any of you guys have any questions, feel free to reach out. With this new position switch, I am pretty busy and stretched a little thin right now, so I might not get back to you right away, but I promise I will get back to you. And if it's really pressing and I don't have the time myself, I'll make sure someone that knows the answer will get back to you and respond. So yes, by all means, please feel free to reach out. I want people to understand what's going on. Don't feel like you're being a hassle or a bother. It'll work better in the long run if we're all on a good understanding. So.
Right. Thank you so much, TJ. Allison, whenever you're ready, or I can screen share. Either way.
Okay, yep, I am ready. Thanks. First of all, thank you for having me here to present. I appreciate the opportunity and I'm excited to share. My name is Allison Peterson. I work for a nonprofit called Phoenix Mobility Rising. And our goal, our mission is transportation access for all. We really look at access to transportation as a social determinant of health, in that having access to transportation allows folks to live fuller and healthier lives. So I'm going to share with you today about the program we are running here in Washtenaw County. It's called the AARP Ride at 50 Plus program. And I'm going to share my screen here. And all right, can everybody see that?
We can see it.
Okay, awesome. So the AARP Ride at 50 Plus program, first of all, it's a confusing name. We, Phoenix, have teamed up with the AARP and Toyota to run what's called the Ride at 50 Plus program here in Washtenaw County. And I'm gonna share with you all about how it works. So we'll talk a little bit about why transportation is important, and we'll really dive into the nuts and bolts of the program. So first of all, why is transportation important? Well, having access to transportation empowers people to age in place, increases access to medical care, helps people maintain independence, facilitates social interaction and community engagement, and reduces isolation. So the purpose of the Ride at 50 Plus program is to enhance access to transportation options in Washtenaw County for older adults and underserved populations. So let's dive in. So what is the AARP Ride at 50 Plus program? Well, it's a mobility as a service program, but what does that mean? I always kind of compare it to, it's like Expedia for local affordable ground transportation. So we have multimodal ride sourcing from several local transportation options. So we've got public transit, rideshare, Lyft is part of the program. We have volunteer drivers, we have specialty services, and we have taxi cabs. So specialty services are like wheelchair equipped vehicles. The service is targeted at serving older adults, age 50 plus, as well as underserved populations in Washtenaw County. The name of the program is confusing because you do not have to be an AARP member and you do not have to be over 50. This program is open to anybody that needs a way to get from A to B. 3 ways to book a ride. We'll look at that in a little bit, but online platform, we have a mobile app, and we have a call center. So what kind of transportation options exist within the Ride at 50 Plus program? First of all, we have rideshare. Lyft participates in the program. We have specialty transportation services like non-emergency medical transport and wheelchair-equipped vehicles. So we have Safeway Medical Transport, Jewish Family Services, their transportation program, the Wave, People's Express. We have regular taxis, Michigan Green Cars and Stadium Taxi participate. We have public transport, AAATA, the Ride participates. We're working on integrated ticketing, not quite there with that yet. And we have volunteer drivers, which I'm particularly excited about because we just launched our volunteer driver program. And that makes for a very affordable ride. So who can use the Ride at 50 Plus program? Well, the focus is on adults age 50 plus and underserved individuals. This program is open to anybody of any age. You don't have to be an AARP member. And if people want to use it, we are going to show you how to use it. What is the service area? The service area is Washtenaw County. A question I get all the time is, well, what happens if, I've got somebody who's in Belleville and they want to come in to Ann Arbor? Well, that's fine. As long as a ride originates in or ends in Washtenaw County, it's all good. It really comes down to the service areas of the transportation providers that are participating in the program. And I should mention that the transportation providers who participate in the program give a discount to do so. So the rate you're going to get using this program to book a taxi is less expensive than if you were to call the taxi directly. How do you use it? How do you book a ride? There's 3 ways to do it. For people who are using the program to source and book and fund rides for themselves, they can call our call center. We have an 800 number. They can book online at aarp.org/book a ride. And we also have an app. And then the other way the program is used is that organizations will use this program to book and fund rides for their patients or their residents or their clients for whom transportation is a barrier to receiving the care and services that they need. So for example, Hope Clinic and Packard Health use this program. The Washtenaw County Department of Veterans Affairs uses this program they all use this program to source and book and fund rides, for their clients for whom access to transportation prevents them from receiving the care and services that they need. And organizations can book rides by calling, or they have their own little online portal to book those rides. Benefits of using the program is really that people have increased access to all of the things that they need: healthcare, employment, education, appointments, special events, worship, socializing, shopping, all of the things that people need to live full and healthy lives. Here are some of the types of organizations that may benefit from joining the program. I mentioned that the Washtenaw County Department of Veterans Affairs and Packard Health and Hope Clinic use this, but community centers, hospitals and clinics, senior residences, faith-based organizations, shelters, and social service agencies. How do you learn how to use the Ride at 50 Plus program? There's a few ways. There's a 20-minute online presentation. I really like it. I think it's well done. It's to the point. It shows somebody booking a ride by using the call center, booking online, and using the app. And We do 90-minute virtual training sessions. I run them. So if that's something you're interested in, you can register for those on our website as well. And you really walk away from those virtual training sessions knowing how to book a ride. And then you can always call our call center for help too. But all the info you need is at aarp.org/ride Washtenaw. This is that 20-minute online training that I mentioned that's at AARP/ride Washtenaw. It's just an overview of the program. And like I said, it's a demonstration of how to book rides. And I think it's well done, short and sweet. The 90-minute trainings get a little bit more in depth. We're not doing them in person at this time, of course, because of COVID, but we are doing them virtually. And just reach out to me if you're interested in doing this for your organization. Community involvement. I know that some of you have been to, I do a quarterly mobility leadership circle meeting, and it's really just a meeting that we do every quarter for community leaders invested in the idea of transportation access for all. So we all get together, talk about what's going on, and allow for feedback and discussing transportation gaps, really just trying to collaborate and solve challenges. So let's take a quick look at how the ride booking platform works. It's pretty simple. This is what it looks like when you go to aarp.org/book a ride. So right here, you put in the pickup address, and then you put in where you want to go. You put in the time you want to be picked up. You can also toggle this depart at to arrive by, and the system will automatically calculate your departure time. Put in the date. This little button here for advanced options, when you click on that, a little window pops up and you can put in any mobility accommodations that the passenger may need. So there's a place to put in, if the passenger uses a wheelchair or a cane or a walker or needs assistance from the driver. There's a notes field where you can put in any information you'd want the driver to know. Patient will have a service animal, or will have 25 bags, or needs help getting from the door to door. Anything that would be helpful for the driver to know goes there. And then you hit search, and you are presented with a list, and the list goes on, of all of the providers that can do the trip. And you'll see the fare there. Now, I haven't updated this slide since we've added volunteer drivers, but volunteer rides are typically about a third of the cost of a taxi ride. So a volunteer ride is $1.75 booking fee and 56 cents per mile. And then the volunteers are reimbursed at 14 cents per mile loaded and unloaded for the rides they do. So a quick plug, if anybody is interested in being a volunteer driver, give me a shout. Here's this, we have a lot of people participating. So you'll see a long list of providers that can do your ride along with the fares. You just hit select to select the one that works best for you. And you're taken immediately to a screen where booking dispatch is done and payment is done right there. Now, if you are a community group booking on behalf of your patients or clients or residents, you're invoiced at the end of every month for the rides that you provide. For individuals booking for themselves, payment is done at the time of booking. Now we also have an app. It's called Phoenix app, and Phoenix is spelled funky with an F. So it's easy to find in the App Store, but it works the same way as the online portal works. And it looks a little bit like an Lyft or Uber, but basically you put in the parameters of your trip, any necessary mobility accommodations, and then you are presented with a list of transportation providers along with their fares that can do the trip. And again, booking dispatch payment is done right there in the app. I just wanted to touch on some current promotions and programs that we have going on. We have grant funding, first of all, for a program called Vaccinate Washtenaw, in which we are offering free door-to-door accessible transportation to and from any COVID-19 vaccination site in Washtenaw County. Oops, sorry, getting a Slack call. Yeah, free transportation to and from any COVID-19 vaccination site in Washtenaw County. Transportation is booked through the Ride at 50 Plus program. You just call either my number, 734-773-0907, or our call center and use the code Vaccinate Washtenaw to book the free rides. It's just a one-call process to book a ride. Now, this program can also be used to pick up masks and pick up COVID tests. So, you know, if somebody wants to go to Meijer and pick up some N95 masks and also maybe do a little grocery shopping, they can use this program to do that, to book that free ride. So we're also through this program offering, funding transportation for healthcare workers who are on the front line of this pandemic. So, for example, we have a respiratory therapist who works nights at U of M hospital. She was taking 2 buses to get to work, and it would take her, an hour and a half each way to get to work. So she is we're providing rides for her to get to work through this program. So that's Vaccinate Washtenaw. Also have some funding for rides for COVID recovery, including education, employment, food, nutrition, or medical. So, while it might not really feel at all like we're in recovery mode from COVID right at this moment, as we do recover, we have funding to provide fare-free rides through the Ride at 50 Plus program for those in need for employment, education, food or nutrition, and medical pharmacy trip purposes. So if anybody that you work with or serve falls into this category, just give me a call and we'll get them set up with the rides that they need. We do have another free ride promo coming. We had a free ride promo this past fall, and it was wide open, unlimited rides. And we thought it was going to last a long time, and it went fast, much quicker than anticipated, which really highlighted the amount of need there is for transportation. This free ride promo is going to launch this quarter. I'm not exactly sure when, as soon as we get the funds in, but we can offer anybody who needs it one free door-to-door accessible ride, open to any passenger, any age, any trip purpose. As soon as we go live with this, I, of course, will let all of you know. And that's it. Any questions?
Allison, I see a question from Cheryl Strumba in the chat,
Okay.
asking if a person needs to qualify before they book rides.
They do not. Nope. The program is open to anybody. So anybody booking rides for themselves, they can just call the call center, book online, or use the app. There's no qualification. There's no contract. It's just it's open to anybody.
Right.
Now, for some of the free funding, the rides where we're offering free funding, like the Vaccinate Washtenaw funds, that has to be, associated with getting the booster or vaccine, or picking up supplies, or perhaps going to COVID-related employment.
So for those rides specifically, then do they go through the call center?
They can call the call center for that. Yep. They can call me. They can call the call center. Either of those. Yes.
Okay. So I'm fairly new. I'm just learning this.
Yeah.
So could you throw like your contact information in the chat?
I will definitely do that. Yes, I will.
Thank you.
Yeah. Yeah, you bet.
All right. I have another question in the chat from Yvonne Cudney asking about capacity limits.
Yeah. We, at the height of our free ride promo, we pretty much hit the capacity limit. But we didn't really have to turn people away. It was a stretch. Our call center was stretched thin. It was just a response that was greater than we had ever anticipated. But in the everyday, we are not even close to hitting our capacity. We have so many transportation providers available. So capacity is really not a concern.
That's great to hear. Thanks.
Oh, yeah, of course. Sure thing.
All right, I have a question from Hannah Abelhady. How do the requests look for drivers? Do they know that a client has booked through the portal?
Yes. Yep. So they will see when their portal looks a lot like the one that I showed you, but they have their own login, and they'll only see rides that people have selected them to do the rides for. And they will see any of those notes. They'll see all of those. They'll see who booked the ride, so they'll know if it's somebody like a person booking for themselves, or they'll know if Packard Health booked the ride. They'll see that it was booked by Packard Health. If Hope Clinic booked the ride, they'll see that. If the ride was booked by the American Legion or by Safe House, or whoever booked the ride, they'll see that. Any other questions?
I have a question. This is Deb. So what about with your volunteers? Do you have a scenario to where the volunteer can actually wait for the individual to give them a ride home?
Yes. If the ride is a scenario in which the volunteer has to wait, we encourage passengers, people, or whoever's booking that ride, to put that in the notes so that the volunteer knows when they are saying, the volunteers get a list of rides, like a pool of rides, and they can all pick and choose the ones that work for them. So they'll know if a ride includes waiting time, and if that works for them, absolutely, they will do that. Yep.
Thank you.
Oh, sure. Yeah. And volunteer drivers use their own vehicles. They go through a pretty rigorous training. We touch on HIPAA and disability awareness. Volunteer drivers are all background checks, federal and state background checks. They have driving record checks. So they're, it's not just any old person driving around. We also have a partnership with, which I'm pretty excited about, with All-Star Driver Education. They have this whole fleet of cars that are just sitting there all day when high school students are in school. And so they are volunteering or donating their time, and All-Star employees are providing volunteer rides in the All-Star cars during school hours. Any other questions? All right. Well, I thank you so much again for the opportunity to share with you about the Ride at 50 Plus program. I'll drop my contact info in the chat, and if anybody wants to learn more or has any questions, just give me a shout.
Thank you so much, Allison. I really appreciate you sharing this great resource with us.
Oh, you bet. Thank you.
All right, Yvonne, if you're ready, you can start whenever you are comfortable.
Can you guys see my screen?
Yes.
Next question. Do you see the correct screen?
I see your
presentation?
presentation, Yvonne.
What?
Oh, I can see your presentation.
Okay, great. So thank you very much for giving me the opportunity to share with you guys today. If my cat yowls, I'm really sorry. I tried to lock him out and couldn't catch him. So I'm Yvonne Cudney. I work with the Housing Bureau for Seniors, Some of you may recognize me from my time at OCED. Obviously, I'm no longer there. I've been with the Housing Bureau for about 3 months now. I'm presenting on income tax preparation for 2021. I know it's 2022, and foreclosure prevention. With me on this call is my coworker, Karin Lindquist, who is our foreclosure prevention specialist. And she manages the tax clinic. So if you have procedural questions that I can't answer, she is here to help me out. HBS does not do taxes, okay? We're not in that business. We just facilitate a tax clinic. The Housing Bureau for Seniors is a program of community health services of Michigan Medicine. Our key initiatives are, well, let's start with this. We're community anchored and community led. We have some key initiatives that pertain to caring for the health of our children, of our families, protecting health and quality of life for our seniors, including those who are homebound, those who live in their own homes, our renters. We help with addressing food insecurity, health, and provide housing assistance and counseling. A few more projects that we have are improving mental health support and reducing substance use.
Yvonne,
Developing, yes.
I just wanted to double check with you that you wanted to present it in this mode.
Yeah, I know for some reason it's not doing it in the present mode, so you get to see my notes.
Oh, okay.
I can work with that. And we develop future health leaders. So some of the programs under community health services that you might recognize are Ann Arbor Meals on Wheels, the program for multicultural health, and our Regional Alliance for Healthy Schools. Some of you might recognize those. And of course, there's us, the Housing Bureau for Seniors. We have a few more projects that are located within Michigan Medicine, like the Michigan Medicine Lodge and the Friends Gift Shop. I don't know how much you guys come into contact with that. The Housing Bureau's mission is to inform and empower older adults and those who care about them with guidance and resources regarding sustainable housing in Washtenaw County and beyond. So we do help out some in Livingston County, but the majority of our callers are here in Washtenaw County, about 81% of them. We're a new team, except for Janet Hunko, our executive director. I think she's been around since, dare I say, time immemorial. The rest of us are pretty new. That we have Karin Lindquist, who I said was here on the call with me. She's our foreclosure prevention specialist. Joy Lang is our eviction prevention and housing counselor. She came to us from Michigan Medicine visiting nurses, so you've probably seen her name around, but she too is in a new role. We have an intake coordinator, Sunana Graywall. I don't think she's on this call. I'm the community education and outreach coordinator. And we have an administrative assistant, Wendy Smith. I did see a Wendy.Smith on the call. I don't know if that's our Wendy, if there's more than one. But all of us have pretty much just started within the past 6 months. So we're getting our tentacles out into the community. The next slide. So you guys, excuse my misspellings in my notes. Just disregard them. How tax preparation is foreclosure prevention. So we run this tax clinic every year. And the reason we do it is because, well, one, we like to help the older adult community. That is our mission. But also tax returns are often used, tax return refunds are often used to pay property taxes, right? The other thing that happens is that the clinic gives us an opportunity to screen our older adults to determine whether or not they're having problems paying their property taxes, whether they might qualify for a poverty or a hardship reduction or property tax deferment. Washtenaw County has about 28 different jurisdictions that have their own requirements for filing a poverty or a hardship reduction. But essentially those allow people to pay less property taxes, sometimes zero, sometimes there's a 50% reduction, sometimes there's a 25. So we can screen at the clinic for the people who might qualify. At the clinic, we're able to distribute the applications and later help with completing those forms. We can also, not at the clinic, at a later date though, communicate with local units of government. We have a fairly good working relationship with Washtenaw County's treasurer, the treasurer's office. Our tax clinic is a collaboration with the AARP, and we are an official AARP tax credits for the elderly site. Our focus is on low-income older adults, but we can assist anyone who schedules an appointment and comes to the clinic. Our services are free, right? There are a couple of other clinics around town that are also free, but I always like to get the word out. I've seen a lot of seniors pay to get their taxes done. So I always encourage them when I worked at OCED and elsewhere to come to the Housing Bureau for assistance. We've been in business for 25 years and we generally serve over 500 individuals a year at our tax clinics. AARP membership is not required, obviously, if the people are under age 50, and even if they're over age 50, it's just who we partnered with for this clinic. There are some filing restrictions. Generally, we can prepare joint and individual returns. We can also do some simple business returns, but outside the scope of our joint and individual returns is rental income, farm income, non-resident alien returns, and state returns other than Michigan. So those types of returns are no-goes for our clinic, unfortunately. Our simple business returns, otherwise known as the Schedule C, are okay, except we can't do depreciation, inventory, home office deductions, or net losses. The other thing, this is not really a limitation, but we can also offer advice if someone is doing their taxes, their own tax return, and they have questions. Here's the big caveat. Appointments are required, right? The clinic is filling up really, really quickly. So we encourage you, if you know any, I'm just going to say for our purposes, since there are other clinics, if you guys know of any seniors, which we define as 55 and over, who may need assistance, please, please, please send them our way. The clinic is scheduled every Friday beginning February 4th through April 8th, and essentially every other Wednesday, although we skip a Wednesday between March 2nd and 16th. I've listed the two numbers that you can call to schedule an appointment. One of them is our intake line and one of them is Karen's number. The first appointment is at 9 a.m. and the last is at 3. The clinic is located at the Turner Senior Resource Center. Some of you may think this address looks familiar for the Housing Bureau, and we used to be housed there. But along with a new team, we got a new premises. So we're no longer at the Turner Senior Resource Center. We're now located at 3621 South State Street, Suite 710. It's known as the KMS building. It's next to United Way and across from that drive that goes into Costco. So that's where we're located. But again, the clinic is located at the Turner Senior Resource Center. If you want the numbers, there they are, both of our numbers. And then this is mine and Karen's email addresses if you'd like to email us any questions about the clinic or about foreclosure prevention in general. I just want to say too, that I didn't address this, but I'd like to at some point give a presentation about all of Housing Bureau services. But right now, this one's just on our foreclosure prevention and tax clinic. So let me see if there are any questions that you guys have. Oh, look at that.
I have a question.
Yes.
I've been trying to type, but it's taken me a really long time. Is there any way we can either receive a copy of the PowerPoint, or could you put the contact information in the chat so that I can copy and paste it into a Word doc?
Sure. Hold on, okay?
Thank you.
We'll also be posting the meeting materials on the Barrier Busters member resource page later tonight. So you should have access by tomorrow on the website.
Okay, thank you. I'm still learning how to get to that, but thank you.
Oh, no worries. There'll be an email sent out when all the materials are available to the entire list server. Yvonne, I do see a question from Deborah Henson in the chat asking if there's a flyer available.
I'm going to let Karen weigh in on that one. I know that we have postcards that we were sending out. I'm not sure if we have a flyer.
Oh, you're muted.
All right. Can you hear me?
Yes.
Okay. We do have a flyer and I can send that out to you, of course. My only concern right now is that out of our 352 spaces, we are down to between less than 40 available to schedule. So I can send you that information just with that as a statement so that we understand the limitations at this time already we're facing.
Was that Deborah who asked that question? Just so we make sure that we follow up.
Yes.
Okay.
Do we have any additional questions for Housing Bureau? All right, hearing none and seeing none, I want to thank you, Yvonne, so much for coming in to tell us about it. We really appreciate how much you guys are doing for seniors out in the community.
Thank you. We really like helping the seniors and helping our community.
Alrighty. I'll go ahead and very briefly give a funding update for the Barrier Busters Emergency Unmet Needs Fund. So right now, we have about $35K in flexible funding for those in Washington County who are under 50% of the area median income. And we have about $20K available for immigrants in Washtenaw County. This fund is restricted for those who have at least one immigrant in their household. Does anybody have any questions about Barrier Busters or funding updates? All right. Well, hearing none and seeing none, I'll go ahead and adjourn. You guys have a lovely afternoon.
Thank you.